Hi, I'm Michelle Ginsberg. I'm a thoracic radiologist, and I'm Director of Cardiothoracic Imaging and Vice Chair of Education at Memorial Sloan Kettering Cancer Center in New York City. So the question is, what is a solid lung nodule and what does it represent? And when we mean a solid nodule, what we're referring to is a density, an opacity that is well delineated and marginated. Now, it may have smooth contours or spiculated contours, but it does have some contours. In general, we think of nodules that are less than a centimeter as small, and those that are larger as a larger nodule. We see that a lot more nodules are detected in general because we're using CT scans for a lot more reasons. And we may be picking up incidental nodules this way, which we used to not. And also our technique has definitely improved over the last decades due to increased spatial resolution. So we pick up smaller nodules which were probably not as detectable in the past. What does a nodule size have to do with malignancy? Well, smaller nodules are less likely to be malignant, and as you increase in size, for example, the odds ratio of a nodule that's less than a centimeter is 0.5%, a 0.52 odds ratio. While as the nodule increases in size from 1 to 2 to 3 centimeters, nodules over 3 centimeters have an odds ratio over 5 to be malignant. So size does carry a weight in malignancy. Similarly, spiculations increases the odds that a nodule is malignant. So a spiculated nodule versus a non-spiculated nodule has an odds ratio of over 2.5 to be malignant. Also, smooth margins. Generally, they're more likely to be benign, but that's different in patients that have a known malignancy. In those, a metastatic lesion is possible because those have smooth margins. Now, the general differential of a nodule is anything from a malignant lesion to benign lesions. We could have benign lesions that could be some type of arteriovenous malformation or a hematoma, or infectious lesions can be nodular in density. So it's not specific, but we try to use certain criteria, like I mentioned, the borders, which are spiculated, the size, and of course the clinical scenario to help us differentiate a nodule from being malignant to one that's benign with etiologies of infectious or inflammatory origin.